So before we start, so is anybody already a participant of a program in 2025? Is there anybody who is already participating in our program, or all of you are thinking about joining the 2026 program? I think most of you are not the previous say participants are not there. Okay. So basically, can I see somebody because it is just like talking to an. So if somebody can switch on your video, yeah, yeah, I think Prashant sir is there, so that
Evening.
yeah, yeah, yeah. So maybe generally people are not used to switching on the videos, particularly in the Zoom meeting. It's fine, that's fine. So at least you can all say something basically to make sure that people are there. Otherwise, it's just like talking to an empty room. Dr. Amit has
Hi
joined.
sir, good evening.
Yeah, good evening, good evening. Thank you for Dr. Vaishali has joined. Okay. So basically, let me start with a small introduction about what we are doing and why this session today. And this is kind of an introductory session for the 2026 Practice Development Program. And what we have done, so this is basically the second year. So we started this program in 2025, and almost 1 year has been over. And in fact, a few of our past participants, like Dr. Amit, is also here. So this started as an experiment, to be very frank, basically, because it started with a small idea. Many of our doctors, we were conducting these Ophthall practice development conferences. Our conference last year was the seventh edition, and this year is going to be the eighth edition. So a lot of doctors attend the conference. They learn a lot of things within a period of 2 3 months, 2 3 days. But end of the day, when they go back, the implementation started to become very difficult. So basically, once we thought like there is no point in just giving the knowledge, but also we need to handhold clinics in how to actually implement whatever has been discussed. And there are two ways to do that. The first way is basically by having a full-fledged consultancy, kind of you appoint a consultant for your own center, and then you kind of he comes and he guides regularly. That is one way. But that way is a little expensive. Maybe majority of the practices might not be able to afford that kind of a model. So then other way is to have kind of an online program, like a 1 year commitment where doctors come together and then we kind of commit to grow the practice for a period of 1 year. And I thought, let us, how do we kind of implement it? The whole idea came from, I don't know how many of you have read this book called Atomic Habits by James Clear, where he talks about the first chapter talks about this theory called aggregation of marginal gains. Basically, this English cycling team, the British cycling team, was one of the worst teams, and then no brand wanted to associate with the team, and basically, British team of cyclists was like a kind of a small disgrace for the country, and they brought in this person called Brailsford. So what he implemented was he didn't do any drastic changes, but he said like, okay, let me introduce small changes every day or every week, and let us start to implement these changes. And once you start implementing small changes, at the end of say 1 year, there is going to be so many changes which has happened, which transform the practice basically. And Dave Bracewell did small things, just like the lubricant of the cycle, or the seat, or the place where the cycle was clean, the dress of the material, the dress material of the cyclist. There were small changes which he started to do. And slowly, within a very short time of, I think, 1.5 2 years, the British team started performing well, and they started continuously winning the Tour de France. So I thought, why not we apply the similar concept for eye hospitals? Why don't we apply the similar thing for eye hospitals, where small changes which can happen over a continuous period of 1 year, which will, and let's see how the practices are transforming. And we were very happy because whatever started as a small experiment, I think there are so many hospital in our first year program. We had almost 35 hospitals which participated for a period of 1 year. The first success of the program is that all of them continuously participated for the full year, which is not very easy because we sign up for a gym, but we don't go regularly. We sign up for a particular course, but we don't go regularly. And so here, because it was a constant commitment from the hospitals, the first success was everybody was in line and everybody was tuned to kind of attend the program fully. The second success was we saw so much of improvements. Basically, we don't want to tell ourselves, but we can bring in Dr. Amit or our previous year participants who can also talk about their experience in the past 1 year. So that was one thing. So then I understood, okay, this is something really working, and if we can impact 50, 100 eye hospitals every year, that's something really going to be helpful. I think Dr. Ravindranath has also joined. Hello, sir. Good evening. Good evening. So that was the whole idea. So basically, what we understood was eye hospitals are run by clinicians, good doctors, good clinicians, good in the subject, good in surgeries, but very poor in the business sense. But now, when you see the corporate hospitals coming, what you need is majority of the time also a very good amount of business skills to succeed in a private practice. So we thought, okay, let us get together a group of people, 40, 50 hospitals, and put them on a full year program. Everybody focused on developing the practice, everybody focusing on improvement, and then see what happens. That is the whole idea. And every month, how this, I think over the next few slides, I will also explain how this program works and how it is going to support and everything. So recently, this was an article, I think 2 days back. It came in the Mint. So General Atlantic backed ASGI hospital is eyeing around 2000 crore investment. So basically, they are having one thing is this chain is also going to go IPO, and they are also having this huge investment coming in. So what it means to the private practitioner? So there are. Power. Can you mute? Okay. So there are two things. 1 minute. So there are two things. What is can you all mute, please? There is somebody who is creating a little bit of disturbance. Okay. So what it means to the private practitioner is one thing. So there is corporate competition which is going to come near you, which has already come if it is not yet come. And this particular thing is very important because ASG or all these chains are now focusing on district level. They are not going to focus more on the urban area, tier 1 or tier 2. They are also going to now focus on the tier 3 towns. And their plan is to open 600, 700 hospitals in smaller district over the next 3, 4 years. So one thing is the individual private practitioner has to upgrade a skill level to the level of these corporate players, the business practices, the systems and processes, the branding, so many things in a private practice. Second thing is if you are smart, you can also, once you develop your brand, once you develop your strength, once you develop your footfalls, once you develop your revenue, there is also a phenomenal exit option for the smaller hospitals. So we are not telling that everybody should exit, but if at all you are looking at monetizing your practice, there is a lot of opportunity for you to think about monetizing also. So once you are, so what we are aiming to achieve through the program is creating a pool of hospitals which are standard, which have standard systems, standard processes, which are also good quality, very good quality customer service, and all those things. Nothing less than what a patient will get in a corporate hospital. So that is the overall aim of the program. And if at all somebody wants to exit, also create a practice of value. That is the whole idea. So if you see, it's the same article where they said like the company is targeting 8 to 10 hospital acquisition and 100 district clinics each year. So either they will open their own clinics or they will acquire the existing clinics. So the competition is actually going to also come to the district level now. So this is about. So what am I going to talk today? So why is this practice development very critical in today's landscape, and what are all going to be the game changing trends in the year 2026? And a comprehensive, I want to also explain you about how this whole program runs for the full year and some proven strategies we can also talk about that during the course of the session. So basically, if you have any questions, you can always pitch in and you can unmute and ask your questions, or else I will continue talking about this. Today, I'm also going to bring in the experts, like who are all the people who are going to. I'm not going to deliver all the 12 months. We are signed up with good experts who will be also talking about what are all the aspects they will be covering in the next 1 year in this program. So the landscape of eye care is constantly evolving. So in terms of patient's expectation, because the patient is no more a patient, he is also like a consumer, he is also like a customer. So he is expecting a level of service because patients are now exposed to the quality level of service in a corporate hospital. So something similar they are also expecting in individual owned eye hospitals. And then, as I said, we discussed there is this huge corporate competition which is also coming in, and then there is also need for the leadership, basically creating good leaders, creating strong leaders who are going to be the leaders of the private practice in India. That is also something about all these things. So, what are the common challenges which are holding these smaller individual practices back? Is one thing is unpredictable patient flow. You are not having a predictable, because in winter months patients are more, in summer patients are less. There are so many seasonal fluctuations for an individual practitioner. So that is one major challenge. And second thing is even getting in the footfalls. Basically, how do you because many times these individual private practices are reaching a plateau stage, like somebody reaches 100 patients in a day and it's been plateaued for more than 4 years, 5 years. In terms of revenue also there is a lot of plateau. So then how do you move from that level to next level? And the second biggest problem, many hospitals, there is no systems. I will say absence of system. I've seen so many big practices doing 1 crore, 2 crore, 3 crore revenue in a month, but maybe still running on paper-based case sheets, not proper appointment scheduling, no good software or HMI, system, and health management systems. And many times, no good system of recalling previous year patients. So many things which are absent in an individual private practice. So that is another challenge which is holding a private practitioner. And most importantly, doctor driven operation, because whenever individual practice is dependent on a single doctor or two doctors, if the doctor is not there, the practice doesn't grow or practice is not happening, or most of the decisions the doctor has to be involved in, most of the decisions, even for changing a bulb in the hospital, or even if the motor is not working, everything is dependent on the doctor, the owner of the hospital, which will eat away a lot of quality time for the doctor. So basically, that is another big challenge which we are seeing. And the biggest other challenge is team challenges. Basically, like there is no staff, good qualified staff, or the productivity of the staff is very low. Staff leaving the hospital, joining a corporate hospital, and then ROI drain. A lot of problems in terms of team, or you don't have an administrative team. Many hospitals don't have a manager. So that is another big challenge. And the other challenge is basically marketing. So how do you get the new patients? And all these are the challenges which are holding an individual practice. And insurance is a major challenge. The competition from the government, basically now the government schemes like Ayushman Bharat and all these things coming in. So there's a huge competition from the government schemes also. So how do this individual practitioner address these challenges? So that is what we will be focusing on the 12 months. And what we saw, apart from going into this, what we saw is basically somebody signing up for this program. one thing is he is also motivated for 12 months to grow the practice. And once you are having a positive approach, so automatically your mindset also thinks about improvement. And the moment you start thinking about improvement, the improvement actually happens. So I'm sure majority, most of the practices which signed up for the first year have done at least a 20-30% improvement, even if they have not implemented everything we said. Let's say we have told them 200 things to improve, but even if they have done only 30-40 improvements, but still the revenue started increasing. But some of them have got very phenomenal response also. And this is just like, see, one more word of caution is basically this practice development program is just like your own participation is also important. How actively you are involving, how actively you are trying to implement these things, because it's in a Chinese proverb, they say the teacher can only show you the way, and then it is you who have to walk in. So we will make sure that we show the way to you, but ultimately it is you who have to walk in and find out the path. That is something also important. So basically, if you are having this commitment, and other thing which we also saw was that there is a lot of cross learning. For example, what Dr. Amit Solanki does, what Dr. Ashwini in Odisha could adapt it. So there was so much of cross learning, so much of cross discussions which also happened, which helped the practitioners to improve. Apart from what we were teaching, but these are the other benefits which happen through the program. So 2026 is going to be a very important year for ICA, basically because one thing, digital marketing. I think most important, everybody is now, if you're not in digital marketing, things are not going to improve in your practice. So how important is digital marketing? And it is going to become, it's already become one of the most essential things for improving your practice. So we will also focus a little bit more on these strategies in 2026. And then, like, to trust through the content, like how do you engage with the patients, how do you educate the patient, and how do you differentiate yourself with good operational excellence. That is also important. And most of the, I think, insurance is something becoming very, very important. And leadership, team building, all those things are going to be the focus areas for 2026 program. So I'm happy to introduce this Ophthall 2026 practice development program, which is going to be like one complete year of transformation for your practice. And what are we going to deliver? What is this program? One thing is we have signed up with very good experts. For example, now I think we have Dr. Prashant Chauhan. There is a team of experts, right, from Prashant to Dr. Thakur to the Dharmendra Satapathy, Ilayas, who is a marketing expert. I will introduce you, and some of them are also Mr. Jagannath is an excellent person in opticals. He was a general manager at Titan. And so we will bring in all these experts who are going to be guiding you over the full year of 1 year. And it's online, it's an online virtual guidance, but it's not like a webinar. Basically, we also want you to be very clear that we are not trying to do webinars every month. We are trying to do a comprehensive program. So basically, you will have these expert mentors, experts who will guide you all around the year for this program. And then we also give you some structured operational systems. What are some Excel sheets, documentation which you can actually use in your practice. And there is a monthly implementation roadmap, and somebody, a dedicated person, will also follow whether all these things are implemented in your hospital. And as I said, ready to use tools, templates, and frameworks for each of these aspects you will be getting. And very important, branding and marketing strategies which have worked for a lot of hospitals shall also be shared. And some amount of training in developing the leadership and insight into digital transformation. All these things are going to be thought over the period of 1 year. So I'm sure all of you have seen this schedule for the 1 year. So it's going to be human resources on 1 month, counseling on 1 month, opticals 1 month, insurance, marketing, personal branding, pharmacy. So all these things we are digital transformation. So every month we take up one particular topic bring in that expert who is going to deliver and handhold you. Quality we have from Shankara, Dr. Kaushik Murli and his team. They are helping us. We are also planning to add something more in this year, which is also some amount of infection control and analytics. Dr. Prashant is going to cover this year, and he is going to also talk about counseling. A few sessions are also being addressed by Dr. Prashant Chauhan. So we have got combinedly, these people have put in years of experience in corporate eye care and in general healthcare. Like, for example, Dr. Prashant or Mr. Jagannath, Mr. Dharmendra Satapathy is a very good strategy expert. Dr. Sridhar Thakur is an expert in, he was a CEO of Vasan Eye Care and a very good expert in strategy, operations, management, finance experts. So each of these people are going to guide you. So you are going to get this network of people, which is also going to be very important. In addition to what you are learning, you are also going to get access to all these experts over the year. So is there any questions till now, or can I finish it and then so, what is going to be the curriculum? So, basically, core curriculum is going to focus on brand identity and positioning your brand, and then creating these operational systems for your hospital so that things become more structured and systematic so that people don't come to you for everything. So, how is that systems created? And how marketing and ROI, what is the return of investment on the marketing? How much you should spend on marketing? What kind of marketing you have to spend? Improving the patient design, personal branding, also insurance, improving your optical outlet. All these things are going to be the core curriculum for the 1 year. So this is the roadmap. What is the roadmap? Basically, it is like initial 1 to 3 months, it's going to be foundation. So how do you build your own core identity? What are all the systems and processes you need? HR management. First 3 months, we focus on building the foundation blocks. Second 7 to 9 months is going to be an optimization where we are trying to go and dig deep into refining your operations, create some comprehensive financial planning systems, conversion funnels, digital systems, implement performance metrics, analytics. All those things are going to be in 7 to 9 months. And 4 to 6 months will be focusing on growth. I think after the foundation, it is also something growth is important. How do you improve your move from skill to scale, and how do you also improve your growth in the existing setup? And 10 to 12 will be on preparing you for expansion. So So these are the outcomes. So we are not looking at improving a revenues alone because we don't want to focus this course on revenue optimization or my revenue increase from 10 lakhs to 20 lakhs. Though that is also going to be an outcome, but that revenue increase is going to happen because of a lot of processes improvement, customer service improvement. We don't focus directly on the revenue improvement. We what we want to deliver is that once you focus on operations, once you focus on conversions, once you focus on good customer service, creating a stronger brand, the revenue will automatically increase. So these are the outcomes which we want you to achieve by the end of the 1 year, by 2026 December. These are the outcomes which we want you to achieve. So I think now who should join? Any ophthalmologist can join clinic. The people ask like, sir, I have only started now. I'm going to start new. So anybody who has got that inclination to grow your practice, somebody already doing 2 crore revenue, somebody who has not yet started, because our participants in the first year was a mix of everybody. So basically we had people who have not yet started, like Pondicherry, we have a center. They are starting the hospital in December, but they joined from January. We even had somebody who was scaled up to 5, 6 centers, 7 centers in Bombay. We had people who have one center which are at 5 lakh revenue, maybe 10 lakhs revenue, 20 lakhs. So wide variety of doctors who are participants of the program, and doctors planning expansion, and practitioners who are other important segment who was practitioner was struggling with systems branding. They had very good practice, but they didn't have the systems in place. They were struggling with branding. They were struggling with digital marketing. Another thing is we also tried to help some of the doctors who were on the verge of closure, who were practicing for 10 years, but revenue was not more than 4 5 lakhs a month. So they were thinking whether I should continue the practice or not. What should happen to my practice? So these are all the people who were helped. So basically, anybody who has a practice or thinking about starting a practice, who's got a scaled up practice, who wants to scale up the practice, who wants to exit, I think everybody can be a part of the program. So how it actually works is basically we'll have 2 to 3 Zoom. So every month we select one particular theme. For example, January will be focused on people management or HR management the first month. So that is the theme. Every hospital of the group, I think already we have 30 to 35 hospitals which have registered for the program. So every hospital will think about transformation, about what am I going to improve, how am I going to improve my human resource management in the hospital. And then we will have an expert like Prashant Chauhan sir who will actually guide you on the full process for the 1 month. So it's going to be Zoom meeting in the initial every Sunday. I think 2 or 3 Sundays in a month. In the beginning, we have a meeting of 2 hours, 4 to 6 o'clock, where we discuss about what are all the things which needs to be implemented, and then we also give you the tools which needs to be implemented. For example, let's say how does an employee handbook look, or what is the joining letter thing, how when a person new employee job, how do you incentivize, what is the leave policy, is there a biometric system in your hospital, or maybe what kind of uniforms are the staff following. So a lot of things which we discuss, then we give you the tools to implement, then we wait for about 10 days. We all are there in a single WhatsApp group, the experts and the participants. So we keep continuously discussing about improving the people management in that month. And then there is a session at either on the third week where we see what are all the things which are implemented. And if you have any difficulty, you can always ask us. And then we give you a new set of things to be implemented, which we might oversee in the end of the month. So it's not only Zoom sessions, it's kind of a complete hand holding and mentorship, which we provide for the full month. And whenever you have doubt, you are free to kind of message or contact the expert also and ask him for guidance during the month. So overall, I think in the end, you can also have my support and mentorship to grow your practice. You are always welcome to call us. Like, see, even today, Dr. Rohit Modi is part of our 2025 program. So he called me about some insurance issue. He said, like, sir, insurance is giving me this much for retina surgery. Should I accept it? So then immediately we help him. I said, okay, let us talk to Dr. Hari. So Dr. Hari is the insurance expert. So he will be guiding you on the insurance part. Small things like counseling. You also understand like how is the counseling being done. If everybody is charging, let's say you're only charging 30,000 as a starting price and everybody is charging 40,000, then you understand that, okay, maybe I should also hike up my prices. So all those things you will learn. So it's kind of a hand holding mentorship and Zoom sessions, giving you the handouts, giving you the tools which are necessary to improve your practice. So let's say we give you 20, 30 items or 40 items which you have to improve in people management in the first month. So it is not that in the second month you are going to forget people management. You can still continue implementing those things till the end of the year. So the next month will be on counseling. 1 month will be on opticals. We bring in an expert who is expert in optical operations. So all these people will guide you towards the growth. So the moment you are understanding it, just like going to the gym. So if you are thinking about going to the gym, then you are in a part of the process. Automatically, health also improves. So that's the whole idea of this program. So it's we do 50% and you do 50%. It also needs your participation, your involvement, and your commitment to develop it to the and reach the what we are achieving to reach. So that's the end of my presentation, and I think we have Dr. Prashant Chauhan sir. So I'll also call in some of the experts who are going to handle the session. So they will also tell what they have in mind and how they plan for the 2026. Prashant sir, you
Thank
are.
you. Thank you, Dr. Senthil. Thank you very much for the opportunity to speak to people. So I think it has been a wonderful, I would say, almost about to end 12 months. We are in the last module where we are doing hospital analytics. We have a session tomorrow, and then we have a wrap up of what we have achieved. And one thing I can share with all of you is that, being a healthcare consultant, I have seen the impact by being on ground with people versus the impact in a remote program, on an online program. And some of these stories, Dr. Amit is one, I would say, would love to hear from him, because he's been one of the very active members of the program in all the modules, and he has shared a lot of initiatives. So one of the focus that we do, because every month is a focus area, is we always seek out what are the interventions you have done at your practice. So if we are having 20 interventions in a month, say it is in people management or in finance or in opticals or in counseling or in marketing, we seek from you that by the end of the month or the next month, share what all have you done. And whether it is improving the way counseling is done, or the way marketing is done, or the way the growth story has happened. Some of the doctors have shared amazing growth stories in their practice based on what they've learned here, and from people who have spent a lot of time being in the sector, being in especially in eye care. So what you will get is the galaxy of experts in their domains. You will get practical insights. One thing which Dr. Senthil and me and other experts have looked at it is that we are not here for theoretical gyan. We are not here to give you things which are plainly theoretical. We are here to give you practical tips. We are here to give you how to implement it. We are here to also hand over a lot of tools, a lot of material for you to implement it. So it's not just plain hand holding, it is also giving you the tools which you can use. And we would love to hear what has been the impact in your organization of different sizes, of different capabilities. So one thing I can assure you that the time and energy that you will invest by attending the sessions. And one thing I would seek out is that if you join this program, please do join the program live. There were some people who were joining in by viewing the recorded content, which is which is available to you on the learning management system, the LMS platform. But you would not have the opportunity to ask questions, because then you can only see what had happened. While if you are participating and you are doing it live, you have an opportunity to ask your queries. So the queries are not just asked in the session. The WhatsApp group also has been a very active 12 months, where people have thrown their queries and their questions, and the concerned experts have answered. Has been very forthcoming in terms of, so there's no holding back of knowledge sharing. One thing I can assure you, based on what the first year has been, it's amazing value for money. You can't even dream of that. For the value that you'll be spending, the return that you will get will be multiple of that, because across the year from the experts, nobody's holding back knowledge. Nobody's just giving you piecemeal, giving you right to all the material that you need, which you can use practice to improve your systems, your processes, your people, your marketing engines, your growth levers. So it would be an amazing 12 months. The things that you have to keep in mind is um, participate in the sessions live, ask questions, throw your doubts at us, get them clarified, and also share your journey of implementation. So there have been few people, as I mentioned, Dr. Amit is one of them, who has very actively participated in the initiatives. It would be also amazing if you're able to do that, because that will also motivate others. So in a group of 40 people, it's the people who need to be the catalyst to motivate others to also, take up the initiative. Sometimes you will be overwhelmed because, you may not have the necessary bandwidth. But if you are able to do even, so don't get that I have to do all 20 of them in a month. Even if you can do 3, 4, or 5 in a month, it will help move your practice to a little better zone and to make it more structured. So one thing I can assure you, based on how this program has happened in the first year, it will be only getting better, because as Dr. Senthil said, this was an experiment. It came out of just a thought that how can we help practitioners to improve without being kind of on the ground associated as consultants. So it has been a wonderful beginning, and it will only get better. And look forward to your joining and coming on board and joining into this journey, shall I say, of 1 year of taking your practice to the next level, like a 2.0 version of your practice. And there are enough capable experts in the fields which they are, have spent years to handhold and help you and clarify all your doubts and concerns and queries that you may have during the session and even otherwise. So that's what I wanted to kind of share with you. Over to Dr. Senthil. Thank you for the
Yeah.
opportunity
I
again.
think I should also thank Dr. Prashant because he has been one of the supporters. The moment I told the idea, he said, like, sir, we should do. And I think I should, I'm very grateful to Dr. Prashant for the thing. And as he said, he never withholds any knowledge. He says, like, okay, there is nothing like a secret with him. So whatever he has, he will always share. And I think that is one good thing which we've seen. And it's been, see, another thing is, see, we don't want to sell this program. We are not selling here. We are not trying to get more. Only our intention is basically to make sure that many people get benefited out of the program. We are not like looking at, this is not a marketing call for this program. I think we already have 35 hospitals which have registered. We can only take up to 50. So basically, only thing is, we feel that when the practices are improving, why not? Some of the doctors have a hesitation like, oh, will it be helpful to me? Can I participate every week? A lot of questions which they had. But see, you need to take the decision. Basically, you need to take that call. That is when things will start improving. So please don't think that we are trying to push the course. We are wanting to market it. And see, in fact, many people have already joined the program are a part of this meeting. So that is another. So there are certain doctors who had a little bit of doubts. Will it be useful for me? Will it help my practice? I have not yet started the practice. And also we wanted to clarify certain doubts. That was the intention of this session also. And as Dr. Prashant said, this is something like we have priced it as economically as possible so that it's going to be helpful. And I don't think anybody will continuously support a practice. And this kind of a program is not being there in any other specialty. Basically, I got requests from infertility specialists, from orthopedicians, from other specialties. Can we run similar programs? But we are also considering that option. But ophthalmology being our core area, we want to support our ophthalmologists along with this. And next, I would like to call Mr. Jagannath. He is a very well-known expert in the optical industry. He's a veteran. He was with the Titan Industries, and he started when I think Titan I Plus had less than 10 outlets, and I think he was there till the journey of almost 700 outlets. And he is also a supply chain management expert, an expert in everything basically, right from sourcing to designing the optic. I think he has been breathing opticals, a very senior person, and he has been guiding us for the optical. So he is going to continue support us for the optical sessions during our program. He will be guiding on the optical program for the period of 1 month. Hari sir, can you share Jagannath sir's PPT? So Jagannath sir, over to you. You can please. Am I audible, sir? Like,
Yeah, you're audible.
yes, sir. Please.
Am I audible, Dr.
Yes,
Sanjay?
sir. Yes, sir. We are audible. The slide is also visible.
Okay. So I'm not going to bore anybody with a lot of slides. I just prepared it so that it is easy to explain. So thank you so much, Dr. Senthil, for the introduction. I think some of the doctors might have heard me during some of those sessions we used to have last couple of years. So good evening to everybody. So this can go to next slide, Hari.
Hari sir, next slide. Next slide. Yeah.
So what I'm going to talk is quickly, very quickly, in the next 3-4 minutes. What are the things which are very critical for the success of an optical outlet in general, and more specifically in a hospital, and how are we going to help you in the next, that I will talk in the second half of other 4-5 minutes. So one of next, sorry, next. So one of the important things for any retail outlet is you can't sell what you don't have. So therefore, product is very important. In the product, you need to have proper range and the proper depth. You should have a proper price ladder. There will be people who come to the outlet, especially in a hospital. Hospital being a place where all strata of society comes. So therefore, it is very important to have products at different price points. And then there are also people who will come, youngsters are there, older people are there, and people who are looking for sporty frames, people who are looking for people who are very classic looking for the office purpose. Kids come and women. So that type of different variety is required. And also you should have differentiated products. Why would they want to buy from you? One is that they have come to an expert who is a doctor, but at the same time, they also look for comfort, design, and build quality. It should be good. So these are the important things. The next thing is that we should have the proper pricing. So if you make a mistake in pricing, then people will think that you are expensive or you are uh,
Hello?
sorry, I think I got cut off because I
Yes,
was
yes. Now we can hear you.
now you
Yeah.
can hear. Okay. So what is important is the right pricing. So because some places in the past 2 years that we have been dealing with the doctors, some people have overpriced themselves. So the multipliers are quite high. Some people have just made a very less pricing, so that but then they will lose money. So pricing is very important. Next slide, Hari.
Sir, next slide. Yeah.
Okay. So when you are doing pricing, suppose we have 500 products on the shelf. So there are products which you should keep for key value indicators. So you must have seen somebody like Lenskart saying starting at 399. Okay, even Titan does things like that. So to attract customers, so there has to be some key value indicators. There are things which are high margin products where there is titanium and very special products. And there could be new products which we introduce. Okay, so you can give higher price, put a higher price in the beginning and then start discounting over a period of time. And then there are cash cows, which are the standard, wayfarers, rectangles, the staple products, where you keep a decent margin. Likewise, so it's not necessary that if I have 500 products in the shelf, everybody has a multiplier of 3 or multiplier of 4. So they have to be different. And that has to be chosen very consciously. Next slide, Hari. But just having the product and pricing it right is not going to help. It's all about the customer experience and customers' loyalty. And you people as doctors know it very well. The trust is very important, and trust comes from experience. This is one category where you cannot advertise trust. Next slide. So how do we get there? We should be relevant. Okay, so as I said earlier, hospital is a place where all strata of so people from all strata of society come. So therefore, we should be able to have products which are good for, which are affordable and which are relevant for all of them. And then there is an experience. So the ease of buying. So it's not that everything is under a counter and the salesperson keeps taking out the one by one. After a time, the customer also loses patience. The salesperson also loses patience. So there are ways of displaying the product. Assistance in selling the right purchase. So many places I have seen, आपको क्या चाहिए यार, what you want. Okay, but that is not what is expected in a optical sale, because it is a highly assisted sale, and that assistance is required to be given. And also you have to alleviate concerns. So some people think, will, for example, will my um, rimless will break fast, or with this thin lens will it be, is it really helpful? So there will be so many questions, because nowadays the optical product is not very cheap. Okay, then there are much better options. So, and there will be a lot of concern, there are a lot of questions. So that is what is the training for the people is required for explaining that. And then there is has to be transparency. So many outlets we have seen there is no price tag. Okay, the customer doesn't know what is the price. So the moment there is no price tag, the customer feels that you may be charging randomly, and so that transparent pricing is required. Explicit warranty terms. So wherever products we may be selling, no unbranded products, we may be selling branded products. Each brand has a different warranty. So all that we will have to explain. Next, next slide, Hari. So because we are in a service business, so there are three key important things in a service business. One is the people. People should have right product knowledge. They should have a customer understanding, and they should behave ethically. And the second thing is the processes. So there are customer facing process, commercial process, compliances. I have seen many hospitals where we see that the malpractice in the optical is not even detected by the doctor, and they are losing heavily. So they think that I have paid very small amount to this optician, so I'm getting away with it. But actually, what is happening is that that person is not qualified, and so he is not. We are actually losing customers. So many places we are seeing conversions of 30-40%, whereas actually the conversion should be close to 100%, or at least 80%. So that the processes are required, and physical evidence, the orderliness, cleanliness, ambience, and the store look. Because now you see that whether it's Titan I Plus, whether it is Gangar, whether it is Lenskart, they all have very modern looking outlets. So our hospital outlets, it is looking very boring and untidy and unkept and boring, then people will not buy. So that's also very important. So these are the things we have to address. Next slide. So the focus is on communication, how to treat the customer, how to retain the customer, how to get feedback from the customer. So many times doctors don't neither have the time nor have the bandwidth to actually engage with the customers. And it's not that I kept selling in the past 2-3 years to all the doctors, saying that the customer has come to you for a visual impairment, in whatever level it is. Okay. Optical is the end point of that solution. After doing all the clinical things, everything, that's the end point. And it is kind of a feeling that the customer goes away, whether they feel that they have got the full solution and the right solution and the best value for money. So that communication is very important, and keeping in touch with them, getting them back. And when they come back, they also come back for your other services. And the moment of truth is that deliver what is promised. So if we say that we are giving you a progressive lens at 1,000 rupees, so we should be able to deliver it. And if we say we'll give you next day, we should be able to deliver it. No, we tell you that is the most comfortable brand, comfortable spectacle I have given. The customer should feel comfortable. That delivery is very important. These are the areas of focus. How do we do this is what we will do. Next. Next slide. Some of the designs we have done for the ambience to look at. Next slide. Next slide. So it is basically what we have, Dr. Sendil and me have done for the past 2 years with many doctors. It's more of a collaboration. It's not about giving Gyan like Dr. Prashant said. We have collaborated with them and tried to handhold them. And they have done. Hopefully, we have done a good job. Many of the doctors who have associated with us. So how do we help you in this course specifically? Is that we'll help you with merchandising. So very quickly, we will know what is your walk-ins, what type of people you get, what space you have. So therefore, what product mix that you should have. That we will give you a suggestion, and we'll give you SOPs. Okay, how your staff to do the work, and how to understand the customer, and how to reorder things. All the SOPs related to the store, right from the store operations to merchandising to commercial compliance, all that we will provide. And we will also provide training to a extent that it is practical to be given in a month's time. We will probably be able to train the key people who are running the optical. 1 or 2 sessions we will provide more in interactive way. And then we'll help you with sourcing if you are interested, and if you are finding it difficult. Okay, sir, you are giving me this merchandise list. So where do I get it? So we can help you with that sourcing. You say, okay, you say that no, we can sell better lenses. Where do we get this kind of lenses? Apart from the international brand, we'll help you with that. And in some case where we find that your store can benefit by a better design, better access, so that design also we can cover. So these are the ways that we will do. Next slide. That's it. So these are the areas and ways that we can help. Any questions? Maybe we can raise with the Dr. Sendil either now or later, and then we can address them.
Yes, sir. Thank you, sir. I think that gave us a preview of what you will be learning in the optical session, and so we got some of the experts. Not all the experts are here today, but just to give you an understanding of what is the quality of people who will be guiding you in this journey. So we have Mr. Ilyas. Ilyas is my good friend. I think no need to introduce him at all. He's already introduced, and he has been supportive of Ophthall right from the beginning days. And Ilyas and Akhil Dave, both of them together will be guiding us through the marketing, because as I said in my presentation, marketing is something important, and they will be guiding you on that particular topic. I request Ilyas sir to kind of give a small preview about what he is planning for 2026.
Thank you. Thank you very much, Doctor, for inviting me again, and also Mr. Akhil for this PDP 2026 program as well. One thing I have to tell you, Doctor, and also the community who is present here today, that PDP 2025 was really a marvelous community, I can say, which was built. The very beauty of that community was that, even during late hours or even on a Sunday, I could find some messages happening. Somebody posting some question or the other, and we will start seeing, replies from Dr. Sendil no matter what time. And then you'll also see Dr. Prashant also responding to it. So I've been a part of so many communities wherein the learning or the knowledge sharing stops right within that workshop or within that particular moment, but it was way beyond that. That was really very interesting. In fact, even I got to learn a lot of things from various dimensions from various experts who were there. So the overview of 2026 is going to be more on the space of what has been happening in 2025. As we conclude 2025, we saw a very big AI revolution in marketing. So my focus is all going to be on marketing and personal branding. So keeping that as the base, how do we actually plan our 2026 marketing plan is the game all about. So starting from, I classified, we will try to cover 5 aspects in this. The first aspect is about, building your own dashboard. Today, there are a lot of things happening in the marketing space, but there is not enough clarity about what one should do. Right from the right target audience you should be targeting, right from understanding your geography, right from finding out which tool is the right tool for you, and also finding out basically what you really want to achieve in marketing. That's very, very important, because with too many things happening, with too limited resources, what are you going to do is a very big thing to understand. So first is about setting your dashboard, understanding where do you really want to go and what do you really want to achieve. With that dashboard in place, you will have enough and more clarity about things that you're going to build around, whether it be starting from, getting the basic communications ready or, distributing the communication. That's the first aspect, setting up the dashboard. The second thing that we'll be looking at is what are the strategies that you can use in marketing to achieve that. This is your dashboard. This is where you want to go. This is your goal. And how do you really achieve it? What kind of a strategy will suit your kind of business or your type of practice, or more particularly for you in that particular region? Third most important thing is creation. What kind of content you can create with the help of AI tools which are available today? A lot of interesting advertisement concepts can be created, which could be helpful in creating a lot of awareness. You can even clone yourself. You don't have to be literally present all the time. How do you create your own clones? How do you even clone your voice? There are a lot of tools available today. So even with less efforts, how can you consistently build your calendar and keep going on and on in the social media space, making the social media very busy in a way, but you being busy in your own practice? So how do you really manage this thing? How do you really balance this thing out? How do you create content and then you start going for all these social media platforms, and what kind of social media platform for what content and all those things? And how do you really prioritize that? That's very important. The fourth part is the distribution part. How, now that you have created a content, how do you really go out and distribute this content? What is the paid media that you can use? What is the owned media that you can use? What is the earned media that you can use? And how do you really collaborate with others who have already made it, and in getting your message out? And what are the various platforms that you can use, communities that you can use, wherein you don't have to really spend money, but you can also build your personal brand and also establish authority. So that being the fifth point, that being the fourth point, and the fifth being how with all these things you can build your recognition. Today it's all about identity. You should be known, your organizational brand should be known. So how do you really build a very strong personal and organizational brand? With that in place, you can actually get the end result of whatever you want in terms of having the right collaboration, attracting the right talent, or it be getting the kind of patients that you want. So this is going to be the 5-step module that we are planning, and we will structure it further with lot many innovative tools that we are having discussions on. And it's really going to be very interesting with Akhil the way he has his own style of presenting things, and he brings his own unique perspectives. We both together, we're going to take you through this. Thank you, Dr. Sendil, for inviting me for this session and addressing the audience. Over to you, Doctor.
This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
I think there's some hello. Yeah. So I think that gave. Thank you, Elias sir, and for being present. We organized this program in a very short notice. We didn't plan because there's so many things going on. And thank you for being present here. And next expert we are going to have is Dr. Hari. Dr. Hari is, I think, also needs no introduction. He has been helping a lot of hospitals on the insurance part. So 1 month of our course will also be dedicated on insurance. Maybe just I will ask Dr. Hari to just come online and
Yes,
tell
sir.
live.
I'm already online, but the thing is, just finished one emergency case and on the way back home, so I'm on the car. So
No problem.
I wouldn't like to turn on the video, but yes.
No problem.
So the idea is that what I have seen with lot of hospitals, after seeing through thousands of bills of hospitals, I see that there are very, very small mistakes that hospitals end up doing because of lack of knowledge, lack of experience, lack of trained staff. So I would like to fit in there, and most of the hospitals are now aware to a large extent about insurance cases and everything. What I would like to do is, initially for that month, we'll have a training session on insurance billing and empanelments. And after that training session is over, then each of you will have a unique set of problems. Every hospital has got a unique set of problems. It's not one size fits for all. So accordingly, we'll look it up, and as usual, I'll be available for all of you to put in any queries even during that 1 month and even outside of it. And anything that comes through the Ophthall platform is always on a priority for me. So I'll be there. I'll be there with you, and let's take it forward in a nice way. And looking forward to a good association. Thank you.
Thank you, Dr. Hari. And I think seeing all our experts, I am also thinking so what kind of people we have. Like, I think this should definitely reach a lot more ophthalmologists, not the 50 people. Maybe it should reach 500 people in a year. So apart from Dr. Hari, we also have, I think we met four of the experts who will be handling, and maybe including me, there are five people. And we also have Mr. Dharmendra Satapathy, who is, I think today he is not available, but he is going to address things like strategy and scaling up. How do you move yourself from skill to scale? Or how do you become? These are towards the end of the program. End of the program, we have those discussions. What kind of investments you should make for the hospital? Or how do you build a larger organization even with a lesser amount of money? I think all those guidance support will be provided by Mr. Dharmendra Satapathy. And we also have Dr. Kaushik Murli and Dr. Geeta and his team for the quality management part. The quality part will be handled by them. I'm also planning to add some more sessions this year on medical tourism, maybe some amount of medical tourism and maybe telemedicine. Some 1 month where we focus on all the latest innovations, latest things which we can tap into, like maybe visiting surgeons. Many doctors go and collaborate internationally. There are opportunities in Africa and all those things. I think 1 month we should. I will get some of the experts who are working in that particular space to kind of give an overview of how ophthalmologists can benefit out of it. And so we have another more, maybe another four or five more experts who will be part of the program and guiding you for this. So basically, I think so we have another 10 to 15 slots open for this year. And if you have not yet registered, please do register and become a part of the program. And maybe before we finish, I'd like to open it up for one thing. Maybe I'll call Dr. Ashwini, who is a participant of our last year program, to give us his view about how has his journey of this last 12 months been. And then maybe Dr. Amit Solanki. See, all the participants are very happy. Don't think that only Dr. Amit or he is talking, but not everybody is open about what they want to. Even if they had a very good experience, not everybody wants to be coming out in public to say. And so, but Amit and Dr. Ashwini, all these people are. I will say they are the stars of the program. Basically, they participated as actively as possible, and they got a lot of benefits. In fact, they have also registered for the 2026 program, meaning that itself shows the value of the program which we are delivering. And maybe Dr. Ashwini and Dr. Amit, you can just give a little bit of your experiences, and then I can open it up to questions. Yeah, Dr. Amit, you can, yeah.
Hi, sir. So, sir, once again, thank you so much.
Doctor,
This one
before
year was a
Dr. Amit speaks, he is going to be like, he is now graduated from a participant to a guide. So he is going to be he will also be one of the faculty of the program. So they are now seniors in this program. Yeah. Yeah.
But
Yeah.
thank you so much. This one year was a wonderful journey. And I, before when we started in January, I told that I have almost 14, 15 years of experience working with the corporate hospital. So I was knowing so many things, but I do remember the first presentation of Mr. Akhil Dave, where he started his first slide with the knowing is knowing and doing is doing. So this is one point which I want to highlight to all the participants for the 2026, that you may be knowing so many things, but unless and until you implement it, this program is not really going to helpful for you. So just make sure that it is really a value of money. This program is wonderfully designed, and it has really helped me a lot. Though I could implement hardly 55-60% only. There are so many things still. 40-45% things are that which I, and that is why this 2026 batch which I have joined is not complimentary to me by Dr. Senthil sir. I have paid it, sorry sir. Just to clarify it, that why I have joined it, because it has helped me a lot. That's why I said the remaining part also I can complete in a second year program, and that helped me. Like, just for an example, lot many points I have noted to improve my website homepage and other things, which I could not implement because for me the other things were priorities. So there are so many things. So and first 2 months, like Senthil sir is always there. We all are saying in Instagram, but I'm sure in first 2 months you are going to love Dr. Prashant Chauhan. The two, like the people management and patient managements, I have worked with him also in Center for Sight, but if Dr. Prashant is here, I am sorry, but that time I was not impressed, but now I have become your fan. The way you took the first 2 months and then they said, oh, this is fantastic. But then again there are few months will come which will, actually you may feel that it is a boring, or you are not able to implement so many things, and then you get a self demotivated that, oh, anyway I'm not going to. So just keep patience, try to implement the things, and the most important thing is you have to have a one dedicated person, a manager, who is going to help you. If you think that I am going to take care of all these points and implement, it is not going to happen. I tried it in my hospital also, but unless and until I had one person who implement all these things. So this is just have a patience, go with the flow. Few session you will feel that, no, yeah, this is boring, I am not going to implement, or I am not able to understand, like, so many terminologies will be there, like abita and all, and so many things. But just have patience and keep asking the questions. As Santil sir always say, it is a time for a collaborations. Like, I should not think that, no, I have implemented, I have learned, and I have grown, so I should not share my ideas and my implementations with the others. No, don't do that. Everybody has his own this things destiny written. So it's better to speak up, to put the ideas, share what you have implemented, then only it is going to help us. So again, with the Akhil's words only, I will finish that knowing is knowing and doing is doing. You have to implement whatever you are learning. And it is wonderful. All the faculties, you are going to love each and every of them. But the first 2 months, like it's, you'll be waiting for the next Sunday program. That is the hold of Dr. Prashant Chauhan. That's what I would say. It is not like he is tapping my back and I am tapping his back, but this is the fact. Thank you, sir. Thank you so much, sir.
Yeah, yeah. So just to clarify, we are not paying Dr. Amit for this thing. In fact, he is paying for the second year program also. So I want to clarify that also.
Yeah.
So basically, that is something which is important. So are there any questions from the participants? Like if you have any questions, we can take up a few questions before we wind up the session. So this is like a re-engineering your practice, because I recently attended the Jagi Vasudev's inner engineering program. So this is kind of, maybe we can call this as re-engineering your practice over the next 12 months. And as Dr. Amit said, every month we may not be performing optimally. Maybe there are some months there is a little bit of lag. So that is okay, because we are on this journey for 12 months. So don't get disheartened if 1 month is a little low, a little slower. I think that's all a part of the journey. Any questions from the audience, from people who have not joined, who want to join? So we can take up a few questions and then we can close the session. Or have all of you decided to join, or all of you decided not to join? So you can tell us whatever you feel. I think this program will work only if you also open up. This will not work if you are silent behind the screens. So it's like a journey. It is like a class. It's like a college. We are going to attend it for the next 12 months together. Maybe somebody is senior, somebody is junior, somebody has a high turnover. I think Dr. Ravindranath wants to say something.
Yeah, actually, I wanted to join last time, but I got to know in between. I think in April, I got to know about the program already. It was, I think it had started. So actually, I attended Ophthall in Hyderabad and Delhi conference. Because of my personal reasons, I'm missing Mumbai. I wanted to badly be in Mumbai, but missing because of my reasons. Definitely excited to be a part of this program. And I've heard already, like I know Dr. Senthil for the last 3 to 4 years. I'm in touch with him and even with Mr. Satpathy also. Greatly benefited by their ideas and thoughts. I think this whole year I'm thinking that I'll transfer my practice to a great level. Hoping so.
Yeah, yeah,
Already registered. I registered already. So.
yeah. We hope he will deliver the expectations are. So thank you, sir. Thank you for joining. And in fact, Dr. Ravindra had take a lot of decisions, I think, after discussions with us, including
Yes.
financial decisions and a lot of things.
Yes. Yes. Actually, I was supposed to take the personal this thing, but I had some other problems, construction problems. So I think now in January we will start. This year we'll see how it will go.
Yeah, yeah. Definitely. So thank you, sir. Thank you, sir. Are there any questions
Welcome.
from the other people? Like if you have any doubt? Yeah.
No, I just want
Good
one
evening.
question.
Yes, sir.
Uh,
Please.
no, suppose if I am not able to join because of some personal commitments, can my manager or someone else on my behalf can join
Yes, sir.
the
Yes, sir. So
meeting?
basically, we request
Mhm.
the manager also to join because, as
Okay.
Dr. Amit said, if you do have some sensible, not even a manager, if you have an optometrist who is very sensible,
Yes.
who has got a good attitude, you can always have that person also together. In fact,
Mhm.
we also want to offer this year's program at a very subsidized cost for PGs. So if you know any postgraduate students in the third year, you can connect us to us. So we would like the PGs also
Okay.
program at a very low cost for them, basically to help them into the private practice. So any other,
And
yes, sir.
and the recordings will be available
Yeah, yeah.
in
So
case.
we have
Okay.
a LMS, so the record, even if you miss the session, you can always go back and see.
Okay. Fine. Done.
Yeah.
Thank you. Thank you so much.
Any other questions? I think somebody wanted to ask a question.
So good evening, sir. I'm Dr. Salman.
Yes,
Uh,
sir.
Sir, I wanted to just tell that I just finished my fellowship and I was planning to start my own practice in my hometown here in Karnataka only.
Mhm.
So I'm like my practice is going to start like around 6 months down the course, starting the course. So I'm hoping that this definitely will be helping me to lay the first steps towards starting my own practice. I'm not sure like how is this going to be because from what I understood,
See,
many of
basically,
like
yeah.
already
Your your
practices.
questionnaire will it help because I'm going to start after 6 months. We've had people who are like join the first program. The hospital is getting inaugurated in Pondicherry, I think this December or maybe January. So basically, just like we go to medical college, learn the thing, then we start our practice. So this gives you a very strong foundation and basically to implement. And the biggest advantage we give you is basically now you can connect with Dr. Ravindranath. He is also in Karnataka. So he will also, you learn, how do you learn what are all the best practices which are with Dr. Ravindranath? This is the only place where you can learn from each other because what we understood from our participants is just like Dr. Prashant was non-hesitant in delivering knowledge. Even our participants were willing to help each other. There are no this thing because generally it is very difficult for two ophthalmologists to reveal their trade secrets or what we do. But here, what we understood was everybody was so forthcoming. Everybody started telling, "Sir, this is how I do. This is how this is my system. Can I change it?" Or so you learn a lot from them. So it's I think there should not be any. See, basically, it is like you have to make the decision, and that is what is going to differentiate you from other practitioners. So somebody who's like say your classmate is starting, but you are going to get equipped with a lot of skills which they don't have. And we are
Yes.
not trained in medical college to all these things. So, and how do you get the network of people like Prashant sir or Jagannath sir or Dharmendra sir? So, a lot of connections you will get. That is the value add of this program. So
Yes, sir.
definitely,
Yes.
I'm sure you will be happy. So it will be. I think we want to help more people like the upcoming people rather than established people. I think Dr.
Okay.
Ravindranath wants to add something.
Oh, something.
Okay.
It's fine.
So anything else, like any other questions you have, please unmute and you can ask. We have another 5 minutes to go.
Sir, I will have just a question, sir.
Yeah, please, please. Dr. Ashwini is our star participant of 2025 program, so he will also talk about his experience.
No, sir. Just one suggestion that try to listen to attend classes live only, because the recordings gets very difficult to listen for 2 hour, 3 hour, because just like that there are so many podcasts or so many AI webinars you never see later. So I will request that you attend it live. Even if was not possible, you can take a headphone, earphone, because yes, recordings are available. So, but what happens? I also missed one or two classes, or I missed few maybe, but I tried my best. But it does not have patience to continue for 2 hours to listen later. So it will better to continue on the live class, attend live classes.
Yeah, I think that is a very important suggestion. But maybe in the due course of 1 year, 1 or 2 sessions you might miss. That is
Yes, sir.
otherwise you try, I think 90-95% you try to attend as much as possible the live sessions. That is what Dr. Ashwini has been suggesting. Thank you, Dr. Ashwini. And any other questions or we have? So you can connect to me. Like I think all of you have my WhatsApp number. So if you have any other questions, please feel free to connect to me. And then I would wish that this 2026 program also becomes a success. And I am personally very happy with this program because I want to be like a platform between these experts and the ophthalmologists. So I don't claim that I am an expert in any thing, but whatever I know, I want to share with the doctors. But I think my strength has been the network of all these wonderful people who have been supporting, who have got so much of experience in that particular specialty and trying to becoming a bridge between the private practitioner and those experts. That is my role, and I'm really happy that I'm able to impact the so many ophthalmologists. Somebody says like somebody in our last program was almost in the verge of closure of the practice. Now he has been doing phenomenally well. He is the 4 times he has made his revenue because it is just a small change in mindset which you need, which will make you things work. And what we understand is the younger generation has a lot of these difficulties, challenges, and we want to support. And in 2026, we are also planning to launch our network clinics. Our conference is happening in January. So if you are possible, please try to attend the conference where you can all meet all these experts directly also. And so let us go on the journey. And thank you for being supportive of Ophthal. And feedbacks are always welcome. If you feel there is something we need to change, something we have to correct, you can always tell us. We don't want to receive only the good feedbacks. We also want to receive suggestions, guidance. Everything is welcome. So we keep improving. So we also, as a part of this program, want to improve compared to 2025. We want to show a lot of improvement in 2026. So that's our goal. And if you know any PGs also, please, they are welcome to join the sessions in 2026. And thank you, everybody. I think we have reached 9:30. And thank you for joining on a short notice. And this video will also be available. And if you know any of the practitioners who will be benefited, please do feel free to refer them for this program. And let us all go on this journey and learn from each other and try to improve and develop. I think life is about progress. I think it is important to progress. So 2026, I think one of the most important decisions if you would like to take is to join this program. And thank you for being supportive, being patient. Sometimes I will say we are also not very perfect. There has been there has been lacks, but I think overall we try to deliver as much as possible and what we have promised to the participants. And see you. Hopefully, I think I can meet many of you in January and let us get it started. So if you want to be a part of the program, please do connect to me. Thank you, sir. Thanks for everybody for joining. And thanks to all the experts who participated today on such a short notice and guiding this program. Thank you, sir. So any questions, feel free to post me in WhatsApp. Yeah. Thank you and good night and have a nice weekend.